So we've heard a lot of discussion about the World Report on Vision being launched in Geneva in 2 days. Why do you think the World Report on Vision is important?
Well, I think it's very exciting to have this report coming out in a few days, in fact. I think there are a couple of things. One, the timeliness of it in terms of it's coinciding or very close to World Sight Day. Two, the importance of the World Report in connection with the Universal Health Declaration that was just committed to by the heads of governments from around the world, and the fact that in that heads of government declaration, for the first time, we have something on eye health. So the World Report on the Vision would add to that declaration and would give the ministers of government and the governments themselves a document from which they can use, a document from which they can work with in order to move forward the challenges of eye health, which is one of the new challenges in health throughout our world today, especially amongst the aging population.
And what is the UN Friends of Vision?
The UN Friends of Vision is, the UN has a long-standing sort of non-formal operation where areas that people and countries become interested in, they tend to pull groups together and form those groups around advocacy for that particular area. The Friends of Vision is a group of us who came together along the movement of eye health and the attempt to make eye health one of the major causes that people can pay attention to. What we found was that eye health was not given the kind of attention that the world needs to be giving to it. There are billions of people with varying forms of eye health challenges, and we tend to focus on eye diseases, and that's after the fact. The eye health and the Friends of Vision focus would bring people's attention to the need to look at issues on vision loss and issues on vision even before it happens, so that we can understand that, like other health challenges, eye diseases and eye health conditions must be given attention now, and in order that we are able to fulfill our commitment and mandate towards the 2030 agenda. There are too many linkages to eye health in the 2030 17 goals that if we don't address those, we would not achieve those goals. And the Friends of Vision is one of the tools that will help the global community towards reaching those goals and applying the issues that relate to eye health.
And so what's next on the agenda for the UN Friends of Vision?
Well, we've grown significantly in a very short period of time. This month, October, makes a year, and we have about 50 or so members attached to the Friends of Vision. And what we plan in the short term, in a month or so, we would encourage and we would work with the World Health Organization and the global community in eye health to launch the World Report, WHO report, in New York and hopefully at the United Nations, so that we can continue to build awareness and attention to eye health. And then we're planning something rather unique as an awareness and advocacy tool to bring awareness at the highest level on eye health. We are planning to have a screening for the entire United Nations community in eye health in November as well. And those are two big areas that we want to use towards keeping the momentum and bringing attention to the situations with eye health in our global community.
And why do you think it's important that IAPV members engage with this work?
Well, IAPB is the umbrella organization, of course, of the iHealth community. And as an international organization and an international body, we cannot do it ourselves. The NGOs cannot do it themselves. And the government and NGOs and civil society have to collaborate in order to make this thing successful, in order that we get the attention that we want. So we at the governmental and policy level will be counting on the civil society organizations like IAPB and its members to be able to reach the broader community at the grassroots level. This thing the eye health is a condition that is from grassroots to the top, or from the top to grassroots, whichever. And we cannot afford to have silos. We have to work together, and IAPB and its members, we look forward to collaborating with IAPB and its members in achieving this collaboration towards reaching the population.
And we were delighted to have you this year as our keynote speaker. How have you found the Council of Members?
Well, it was very engaging. I sat in at a number of the sessions and found them very interesting in terms of addressing the problem. I think the key problem that, or challenge that civil society have had in this particular field is that it's a field that has had a lot of success in moving the needle towards addressing eye health diseases. But what it has not truly done is integrated its work into government programs. They have had collaboration and partnership, but we now need to take that partnership further so that it is part of universal health. And I think I heard a lot of conversation over the last day or so and towards that end, how to advocate, how to build partnerships with government, and how to make sure that your work is seen as part of the universal health menu so that we can integrate all of this, and that when a child or a senior citizen of any society goes for medical checkups or mandatory visits to their doctors, that eye health is considered within that menu.
Thank you, Ambassador Webson.
Thank you.